Hello, good morning. I'm Dr. G.S. Kohli, practicing medical consultant in Rajouri Garden, New Delhi. I own my own nursing home, Joy Nursing Home, in Rajouri Garden. I have about 40 years of experience in handling diabetes and other medical diseases. Today, I will be talking about heart disease in diabetic patients. Why we have chosen this topic? I have chosen this topic because diabetes is a rampant disease in our part of the world, that is India. We rank number 2 as far as the number of diabetic patients are concerned in the world. We are just behind China, and with the amount of increase we see every day in diabetes, I think we are going to even cross China in 2045. We have right now more than 70 million diabetic patients in the world, which is a huge number. And why heart disease? Because diabetes are more prone to heart disease than a general population. And diabetes, just to give you an idea how important is the heart disease in diabetes, let me give you some figures. Diabetics are 2 to 5 times more likely to get heart disease than a non-diabetic. Secondly, diabetes more likely to die of heart disease. 60 to 80% of diabetics die because of heart disease. Heart failure is more common in diabetes. And lastly, the hospitalization for heart disease is very common in diabetics. So this not only adds to the death rate, but it only adds to the cost of treatment of this diabetes. As we are all aware, heart attack is very often seen in diabetes, and putting the one stent in a diabetic means losing lakhs of rupees on the part of the patient. Now the question comes, why heart disease is so common in diabetics? So what happens in diabetes that leads to heart problem? As we all know, what is diabetes? Diabetes is raised blood glucose level in the blood. Why this blood sugar is raised in diabetic patient? As we all know, in our body, the blood sugar is maintained by insulin. So in diabetes, either the insulin is deficient, they have less of insulin, or this insulin, whatever is circulating in the blood, is not effective. So with the result, the blood sugar starts rising in the blood and it leads to diabetes. And this in turn can lead to complications involving the various parts of the body. Today we are only concentrating on the heart disease. So what happens because of the high blood sugar level, there is increase in the cholesterol, and this cholesterol gets deposited in the arteries of the body. So decreasing the blood supply everywhere. So when this blood supply is decreased in heart because of the narrowing of the artery, because of the deposition of the cholesterol, what we call as atherosclerosis or atheroma, this leads to heart disease. And when this blood supply suddenly stops going to the heart because of a clot there, we call it a heart attack. So second way it can affect heart is by weakening the muscles of the heart, what we call as myocardium. So as we all know, heart is a pump. So when the muscles of this pump become weak, it leads to heart failure and emergency admission in the hospitals. So having understood the cause of the heart disease in diabetes, let's now come to the point how to prevent this. So of course, the most important aspect in the prevention is prevent diabetes. How will you prevent diabetes? Because diabetes is the root cause of heart disease in these patients. So first prevent the root cause, that is diabetes. So that we can do by knowing little more about diabetes. That is called ABC of the diabetic. What do you mean by A? A means checking the HbA1c of the patient regularly, and so that we can detect the diabetes at an early stage, because it is seen if we delay the diagnosis, delay the treatment of diabetes, the heart complications have already set in. So you can't do much after that. So you have to diagnose diabetes early and treat it. Normal HbA1c we talk about is less than 7. So we have to keep our HbA1c less than 7. So what do you mean about B? B means the blood pressure. So we should get our blood pressure checked regularly, and if it rises, we have to treat. And C means cholesterol. So at least we should get our lipid profile done every 6 months or so and treat it if raised. So having to know about diabetes, second step is what else you can do. We have to change our dietary habits. So eat right kind of food if you want to prevent diabetes and eventually the heart disease. And what do you mean by right kind of food? As we all know, we have three constituents of our food: carbohydrate, proteins and fats. So emphasis should be on eating the right kind of carbohydrate, because our Indians have very high carbohydrate diet in our diet. Carbohydrate in our diet. So we have to decrease the simple carbohydrates in the diet like rice, sugars, and take more of fiber diet. Secondly, fats. We have to concentrate on the fat content of the diet. You have to cut down the saturated fatty acids and take unsaturated fatty acids. For example, if you are taking ghee, desi ghee or other ghee, you have to replace it with refined oil. So then decrease this salt in your diet, because it will prevent the onset of hypertension or the increased blood pressure. So how you can decrease the salt in your diet? Just concentrate on the cooking salt. You can use salt while cooking, but cut down or stop taking table salt. Table salt means don't take any salty things with your tea snacks. Don't put sprinkle salt on your salad or take salty paratha. So you cut down the table salt, but you can continue to have cooking salt. So having cut down fats, having cut down simple carbohydrate, and having cut down salt in your diet will help a lot in controlling your blood sugar and the blood pressure, and also the lipids or the cholesterol. So we have got two types of cholesterol: good cholesterol and the bad cholesterol. Good cholesterol is called HDL cholesterol, high density lipid, and the bad cholesterol is called LDL cholesterol. LDL cholesterol will be improved by your diet restrictions, but HDL will only improve. But what I am coming to the next part of your management, that is exercise. So having talked about the special diet requirement in this disease, the second most important part is exercise or physical activity. Why the diabetes is on the increase? Because we are all leading a very sedentary lifestyle. We don't have time to do some exercise. And what do you mean by exercise from medical point of view? And the best exercise is going for a walk. And it has to be 45 minutes a day for at least 5 days a week. So if you exercise or go for a walk every day for 45 minutes, I think it will help you a lot. So after exercise, then comes the stress relief. Because today the life is so hectic, we are undergoing a lot of stress, and this stress in turn leads to increase in the blood pressure, increase in the blood sugar level, increase in the weight. So what you can do is you can follow some simple procedures like yoga, meditation to relieve your stress. Then fourth part, once you are detected with diabetes or hypertension or high lipids, go to your doctor and take treatment. Because many of the times I have seen patients have blood pressure, they don't go to the doctor because they say, okay, we have no symptoms. Why should we take the medicines? But let me remind them that hypertension is a silent killer. They can suddenly get a stroke or heart attack and die. So, if you are detected with high blood sugar level, high cholesterol level, or high blood pressure level, next thing you can do is go to your doctor and take treatment. Then, after having taken the treatment, that doesn't finish your work. You have to be under regular follow up of the doctors because you have to monitor all your parameters like blood pressure and blood sugar level regularly so that they stay in the desired range. They do not go out of the range. And meanwhile, we also have to monitor your lipids or cholesterol level, and that you can do it every 3 months or so. So, having known about diabetes, how to manage your diabetes by exercise, by diet restriction, and by regular follow up of your blood parameters. I think if we can do that, we can do a lot to prevent the death rate or development of heart disease in diabetic patients. Thank you very much.